Hello, this is Dr. Shakir. So today we'll see, is it worth doing a BDS graduation in India? What are the career options that you can do post BDS and what salary you can expect after completing your BDS? So it takes you 5 years to complete BDS, that is 4 years of academics and 1 year of internship. And in some states in our country, it is 4.5 years of academics and 1 year of house surgeons. If you have some good score in your NEET UG, you can apply for government dental colleges in your respective states. And if you have some excellent NEET score, then you can directly apply to AIMS in any of its branches. The speciality of government dental colleges or AIMS is that you definitely have a lot of patient exposure, which will in turn make you a good doctor one day. And of course, there is only a nominal fees they will be charging every year, unlike a private institution where you will have to pay in lakhs. So always try to get some good score in your NEET UG and try to get into this government dental colleges or AIMS for all these perks. Now, if you could not fetch a competitive rank and you are not able to enter into any of this government institution and you are opting out for a private institution, the first thing that you have to do is always inquire about the patient flow in that particular institution, because at the end of the day, how many patients you did is what matters. So for that, the institution should have a sufficient patient flow. That is one thing you should inquire primarily. Another important point to add is this government institutions provides a reasonable stipend during your house urgency, whereas in private institution you should not expect stipend because not all the private institution gives you a stipend during your house urgency. Now after 5 years, once you are graduated, you have different options to choose. Number one can be starting up your own clinic. If you are confident enough that you have gained enough experience from your graduation, you can straight away start your clinic. But for that, you need minimum 5 to 10 lakh to set up a decent enough clinic with all the necessary equipment. The second option is choosing post graduation. So for that, you have to write NEET MDS. Once again, you have to appear for NEET. And as I explained before, you can pursue a post graduation in a central government or state government institution if you have a good rank, or else you will have to do it in a private institution. Again, the criteria for patient flow is very important while you consider your college for post graduation. Again, if you could fetch a good enough rank to get into any central or state government institution, there will only be a nominal fees during all the 3 years of duration. But whereas on the private institution, the fees for PG seats will be hefty. So only if you are financially stable, you will be able to afford that. So always try to get into government dental colleges or AIMS. Now the third option is you can work under someone in any private clinics, or you can work as a lecturer or tutor in any private institutions. But unfortunately, the sad or the disappointing part is that you choose either of it, whether you work under somebody in a clinic or you work for an institution, your pay scale will be somewhere between 10 to 15K on an average. Yes, you heard it right. Your pay scale will be between 10,000 to 15,000 Indian rupees. There may be exceptions where clinics will pay you more than 15K, somewhat like 25K, etc. But always understand that's not the majority. Majority is where you will get paid only under 15,000. Next, the fourth option is waiting for vacancies from central or state government job openings such as National Health Mission or ESIC or ECHS. But such opportunities are not always open. You will have to wait for the notification, and once the notification comes, you will have to apply. And sometimes there will be a written examination, and sometimes there will be a direct interview, or sometimes there will be a combination of both. In either way, you will have a decent pay if you can get into that. Sometimes the pay scale can vary between 50,000, that is 50K to 75K. The fifth option is you can choose to join Indian Army through Short Service Commission, and for that you have to clear your NEET exam again. So these are the 5 options that you can choose after completing your BDS. I hope the points were clear, and I hope this video helps you to take a decision.